Imagine being told you have a progressive, incurable condition and then waiting over a year just to see a specialist. That's the reality for so many people with Parkinson's, and the number of people with Parkinson's is set to double by 2050. When my constituent Carol was diagnosed in 2009, she was only 46 years old. Consultants told her they hoped a cure might come within a decade, but 16 years later, nothing. Now, I must at this point declare an interest. My daughter Molly is a PhD researcher with a brilliant team at the University of Southampton working to understand Parkinson's so that better treatments and cures can be found. And as a member of the APPG for Parkinson's, I know great work is happening elsewhere too, particularly through the Brain Bank at Imperial College London. But research alone is not enough. People living with Parkinson's need care now. Just before the general election last year, the current Secretary of State for Health, in his shadow role, admitted in Parky's Politics in the Pub that there were not enough neurologists and committed to fix it. He said, "We campaigned hard on workforce to get the last government to commit to doubling the number of medical places so we can drain up staff, especially in neurology where we have shortages." And he said he would deliver that workforce plan. And yet today, waiting times are unacceptably high, not just for initial appointments but ongoing care. One constituent in... Yes, of course.
I thank my honourable friend for giving way. I want to pay tribute to the 459 constituents of mine who have signed this important petition. Would she agree with me that as well as swift access to neurologists, access to specialist nurses is absolutely vital, and also having a named GP for long-term conditions such as Parkinson's disease? One of my constituents who wrote to me said her father's just had his medication changed. He's having real problems with it, but won't get to see anybody until March. We could reduce unplanned admissions with that sort of support.
I'm so pleased that she made that intervention, as I'm just coming on to tell people about my constituent in Wimborne, who said that he, his brother and his nephew have all been diagnosed with Parkinson's. When he was first diagnosed, he saw a Parkinson's nurse every 6 months, then annually, and now, because there is just one specialist Parkinson's nurse covering my constituency, he's seen nobody for 2 years. Karen, also from Wimborne, emailed me and said she had an appointment with a neurologist, then one with a nurse. She now faces a 14-month wait for her next appointment. And across England, as we've heard, half of patients meet their 18-week target. And we know early support from physiotherapy, speech therapy, clear information keeps people healthy for longer. So if the government is serious about transforming the NHS, it cannot allow people with progressive conditions who need a multidisciplinary approach to be forgotten. When the NHS workforce plan comes in the spring, I want to ask, what assurance can the Minister give that neurology, and Parkinson's care in particular, will feature strongly? It's great that the government have expanded medical places, but what assessment has been made of how this translates to neurology services? And given the training time for such expertise, what is being done to bring consultants from abroad to tackle the crisis now? In my constituency, there are 333 people living with Parkinson's. On average, each will be admitted to hospital at least once a year, 2/3 as an emergency, spending a week in an unplanned acute bed. This is simply not acceptable, and we need to do better now.